Hello and welcome to the case of the month in August 2017. The case was made by Master Dental Technician Maria Prongratz and myself. We restore or repair a broken tooth in position 1-1. Here the picture en face, laughing, with lips and without lips. Tooth 1-1 had a crown we made, but our patient fell from a construction site and broke his tooth again. You can see here the root canal treated tooth with a metal post and metal ceramic crown. After removal of the crown, there's not much substance of the tooth left, and additionally had a vertical fracture distally. So we decided to take the tooth out and place an implant immediately. First of all, we take the color, take an impression of the situation to be prepared for the temporary. In that session, we always split the tooth mesiodistally to not damage the buccal bone and remove the slight inflammation apical of the root, and then check the bone, especially the buccal membrane, the buccal bone, the buccal plate, and then prepare for the implant. In this case, we place a diameter reduced 3.1 Zimmer Biomed static implant, which just needs to burr to prepare the implant cavity, and then the implant is placed parallel to the apical crest of the palatal bone, and then immediately prepare for the impression of the position of the implant with the prefabricated splint and just temporary material. After the impression is done, we just close the gap between the implant and the original tooth cavity with bone of bovine origin. And in this case, we also used a connective tissue graft to strengthen the buccal tissue. This is not necessary, but in this case gave us a better feeling, as the level of the gingiva was playing before, and we just want to make sure that we have the same level of connective tissue and gingiva after the placement of the final restoration. Then the work goes into the laboratory, and within the next 1.5 hours the patient will rest, and this time we produce a temporary, and first produce the abutment and then use original tooth shape to make a temporary out of resin, which is smaller in diameter and width than the original tooth and has no contact approximately, and in static and dynamic occlusion. You can see the x-rays directly after placement, and on the right side 3 months later. And then we take off the temporary, put it on a laboratory analog or implant analog, and make an impression of the emergence profile. Place the impression post or impression coping and fill the gap with self-curing temporary composite or tetric flow, whatever you like. Pattern resin would be okay as well. And then place that individualized impression coping back and take the impression. And 2 weeks later, we place the final restoration. Thank you very much for watching, and I hope you enjoyed that little case. Thank you.